welcome to the North County Healthcare Summit. I believe it's the first, but I fear saying that sometimes because then when someone comes up and reminds me, well, we did that 5 years ago. So, welcome. By show of hands, how many baby boomers are in the room? Well, I'll tell you this, baby boomers rock. So our panel of healthcare experts today are going to, and I warn you early, depress you a little bit with the statistics because we're all going to be living a lot longer. We're all probably going to need to get another job or do something else because we're going to get bored in retirement. And some of us may outlive our money. So that's not a bad thing because you're going to have a lot more lifespan to be able to enjoy all those wonderful things like good wine and North County. We will build you back up and we'll give you hope and a path for the future. I'd like to begin the morning with the Pledge of Allegiance to our nation's flag. So if you would all please stand, place your hand over your hearts, ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You know, it's wonderful to see so many of our community partners out there, and I have been blessed in this job in the 33 months that I've been here in San Diego to really come across some incredible people and great organizations and wonderful companies. And I have a lot of dear friends that have been great supports of myself personally and also our organization, and I really appreciate all that you do. At this time, I'd like to ask those San Diego North EDC board members that are here to stand up, if you would. I know Brian Lee, our chair, is here. David Bennett. And I want to thank them for their continued stewardship and leadership of this organization. They have been incredible, positive visionaries for the organization, and they've been incredibly supportive of the things that I've wanted to accomplish for the organization. And without them, we would not have been able to do what we've done. So thank you for your servant leadership. Now I'd like to thank our title sponsor, Tri-City Medical Center. In addition to the title sponsor, they have also made it possible for KOCT to be here today. They provided a grant to KOCT, and they graciously are utilizing that so that we can capture this event on video for everyone to be able to use and that we do not lose the conversation. So a big thank you to David Bennett and his Tri-City Medical Center team. I'd also like to recognize our supporting sponsors, CW Driver, At Your Home Family Care, Scripps, Kaiser Permanente, Palomar Health, and the San Diego Union Tribune, who have all played a large part in making today's huge event a success. So lastly, I direct your attention to the printed program. It's this beautiful thing here. So on the back, you can see all of our other exhibit sponsors, and I encourage you, our title sponsor, and I encourage you to go out to the exhibitors and find out all those wonderful things that they're doing. So please join me in thanking all of our sponsors, and thank you all for being here. So we brought together an incredible team of experts who will focus on and explore the new economy of aging baby boomers and the impact on healthcare, careers, and jobs. Before I do that, what I'd like to do is invite Chuck Atkinson up from Vance. They were gracious enough to make this facility available to us today, and they've been really tremendous. If I can, I'll give a brief introduction to Chuck, and he's going to have a couple of minutes to chat about the great things that Vance is doing. He's retired U.S. Air Force Reserve Chief Master Sergeant, served in the U.S. Coast Guard Reserve, U.S. Marine Corps, and the U.S. Air Force Reserve. Past Commander of American Legion Post 146. He has Associate Arts degree, Accounting, Orange Coast College, extensive accounting management experience, Overnight Transportation Corporation, Brunswick Corp., Science Applications International Corporation, and General Atomics Aeronautical Systems. And he's an American Legion Life member. And so if you would please give me a warm welcome.
Good morning. I'd like to welcome you all here to the Veterans Administration Systems Building. I know probably a lot of you, it's the first time you've been here, and we welcome you here to see what we're all about. We are a 501c3 nonprofit organization. We have 38 different veterans organizations that come under our umbrella. This building is run by volunteers. Nobody gets a salary here. We'll all do it because we want to give back to the community and the veterans that have served this country. This is a home, like I said, of 38 different veterans associations throughout North County. In addition to that, we're a one-stop resource center for the veterans and active duty and their family members in the community. And that means a lot of services. Every time people walk in the door, it's something new, whether it goes from education, training, health, financial, housing, you name it, comes through that door every day. Some of those resources we have in-house, others we are bridging tool out to you people to service the veterans and active duty to come through these doors. So it's a lot of things we do here. We do training. We have fiber optics training, certification, which are high-paying jobs. We have a career transitioning assistance program, which helps the men and women coming out to make that bridge between military life and civilian life again. Most of them have been in there for 20-plus years, and it's a different world when you step from that environment into this environment. We help them get jobs and prepare to go for those jobs. We have training, other classes that we're working with manufacturers throughout the community here for job skills that they need, as well as working with Maricosa College to make those things happen. But we welcome you here today. I'd like to meet some of you that I know you have some resources that we could benefit from. You could benefit, the veterans could benefit from by kind of bridging the gap here. So I look forward to seeing some of you after the meeting here today. And thanks again for coming.
I also wanted to make sure that I recognize the chair and the vice chair of the Tri-City Medical Center Board of Directors, Larry Shalek, chair, and Jim D'Agostino, vice chair. Thank you. So at this time, it's my sincere honor and pleasure to introduce Kapua Connolly from the Tri-City Medical Center. And Mr. Connolly's bio is in the brochure, but I'm going to go ahead and hit some of the highlights if I may. Mr. Connolly has more than a decade of health administration and general management experience in the healthcare industry. He's currently the Chief Operating Officer of the Tri-City Medical Center, and prior to this, he served 3 years as the Chief Executive Officer of Fallbrook Hospital in northern San Diego County, which is managed by CHS, affiliated for the Fallbrook Healthcare District. Mr. Connolly was directly responsible for oversight of all hospital, clinic, and skilled nursing operations, and was able to improve operational efficiency, decrease staff turnover, and help earn a 2013 top performer on key quality measured ratings from the Joint Commission. And that's a big deal. He holds a master's degree in health administration and a bachelor's of science degree in management from Tulane University. If you would please give me a warm welcome.
Before I get started, I wanted to kind of introduce to the community our new commercial that's going to be showing and airing next week. So let's give it a whirl here.
Tri-City Medical Center, a leader in advanced healthcare close to home. Meet former NFL and 3-time Pro Bowl player Willie Buchanan. He retired after a decade in the NFL, but not before it took a huge toll on his knees.
I was in so much pain that eventually I wasn't able to do a lot of activities.
Willie realized that surgery was probably his last option and researched extensively who he would trust. He chose Tri-City Medical Center's Dr. Helgager, who performs about 200 total knee replacements a year.
Willie was experiencing severe pain from bone-on-bone wear in both knees. After consulting with him, his best option was knee replacement surgery. I knew this surgery could give him back his quality of life.
The surgery took less than an hour. I'm now pain-free and back to my daily activities, which include doing what I love best, playing golf. I'm so thankful for Tri-City Medical Center and their doctors.
Willie's just one example of how Tri-City Medical Center is dedicated to getting you back to doing what you love. Tri-City Medical Center, advanced healthcare for you.
That is our first 60-second commercial that's actually going to be airing next week on all the major channels here locally. And, you know, kind of watching this and then watching the Chargers play Sunday, I wonder if Willie might want to come out of retirement to help our boys out. So. No, but seriously, I think this is another example of how Tri-City Medical Center tries to partner with our local physicians to improve the quality of care in our community. So before I get into my spiel, I do want to thank Paul Sesson for agreeing to be the moderator for this panel today. I think Paul has been the voice of healthcare for our community for several years and has created some great perspective and also dialogue with healthcare providers. So thank you for agreeing to moderate. And to kind of piggyback on earlier comments, I do want to thank Chairman Larry Shallak and Vice Chairman Jim D'Agostino for coming and supporting this. They've been very supportive of Tri-City's ongoing community collaborative, so thank you guys. I have always been a big fan of panel-type discussions. I think they create multiple perspectives on a common issue. And today's common issue that we're talking about today is how we're going to gear up healthcare and the delivery of healthcare for our aging baby boomers. From a Tri-Cities perspective, and we have been gearing up and will continue to gear up for the 10,000 plus individuals graduating into Medicare daily. But it's not going to be just from a standalone hospital, community hospital perspective. We like to look at it as our gearing up as more of a collective system, okay? And that collective system that we're trying to ramp up and will continue to ramp up is really geared towards keeping people local and getting their wellness close to home, okay? So that system, and just to kind of give you guys perspective of what it is and what we've done, includes over 2,000 employees. And I think we are one of the largest employers in North County. We also have over 240 credentialed physicians on our medical staff, so we have a bandwidth. Our ERC is over 70,000 visits annually, which is the third largest in San Diego County. And of that 70,000, 25% are represented in our baby boomer population. We are the only active hospital. We are the only hospital in an active ACO, which helps us gear us towards taking care of current and future Medicare lives. And we've invested heavily in the ambulatory services. We have surgery. We've invested in joint ventures for surgery centers, infusion centers, and also imaging centers to help create a more cost-affordable delivery system for the baby boomer population. We've also this year, and hopefully one of many, opened up a PCP clinic, and we've engaged 4 great providers to create access for the baby boomers. And lastly, as far as highlighting, we are one of only 3 hospitals in San Diego County to receive an A+ rating for our quality from the Leapfrog organization, actually the only one in North County. So in saying that, I want you guys to get an understanding of what we have done over the last 3 or 4 years and will continue to do. But it is a big challenge. And as we go through today's presentations and panel discussions, you're going to see multiple different perspectives on a common issue. And how do we go about creating a solution? I don't think we're going to walk away today with the answer, but I think we're going to have a lot of questions for people like myself to kind of ponder and try to work towards. What I can be for certain is we got to change. With 10,000 baby boomers graduating into Medicare daily, the system has to change dramatically. And I think as a baby boomer population, you guys bought into a system and were promised a system. And people like myself and my colleagues that will sit on this panel have an obligation to deliver that for you. So I don't want to take up too much time, but I do want to say thank you for inviting me, and I'm hoping for some meaningful discussion. Thank you.
Well, thank you very much. I wanted to put up a slide of our board of directors, and I think I probably prematurely asked them to stand, but I see a lot of them have come in. I would like not only our North County Economic Development Corporation trustee officers to stand, but also our board of directors. And to the right of me is the slide for our San Diego North EDC. If you would please stand and be recognized. Thank you. Well, we are spot on time. I really like that. So it's my honor and privilege to introduce Paul Sisson. He covers healthcare for San Diego Union Tribune, and his work focuses on how healthcare policy and practice connects with patients in the real world. Common topics range from Obamacare, public health, to new medical procedures, and trends in healthcare delivery. Before joining the Union Tribune in 2012, Paul worked the healthcare beat for the North County Times. Paul lives in Oceanside with his wife and 2 elementary school-age children. Paul's a member of the Association of Healthcare Journalists and holds a degree in journalism from Augustana University. If you would please give Paul a warm welcome.
Hello, everybody. Wonderful to be with all of you today. I was looking at this agenda. It says on here, aging baby boomers. And that, I don't know, I'm not in the baby boom generation yet, but it seems, my folks are, and it seems almost a little insulting. I have seen the baby boom generation aging, and man, they don't seem to be slowing down at all. My folks are both 63. Every Friday night, they're out at a different local craft brewery with their friends. You know, they have a monthly block party with everybody in the neighborhood, and progressive dinners when they're not doing that. So I think they've got a lot of life left. I think it's fair to say. So let's not. I guess what I want to say is let's not get carried away here. You know, we're not talking necessarily about the seriously old generation here. But that said, we do know that we have a demographic shift that's underway. You know, I looked up some numbers on that. As we journalists are wont to do, we have to have facts at hand. So according to SANDAG, the San Diego Association of Governments, there were 374,000 folks Medicare age 65 back in 2012, and by 2035 there will be 750,000 that are at least 65 years old. So it's going to double. In the next 20 years, we're going to see a doubling of the population in our county that are old enough to receive Medicare. So that really is, I think, a significant change, and one that we all have to prepare for, especially those in the healthcare sector. And as we know, healthcare is changing dramatically, even as we see this demographic shift. We're seeing healthcare itself move from inpatient care, people being in hospital beds, to outpatient care, where I think over 50% now of healthcare is actually delivered outside the hospital. So we have several different things going on simultaneously, and I think our panel can really help us understand not only those two trends, but also folks living longer and a greater incidence of Alzheimer's and dementia, which puts a huge strain on families, puts a huge strain on the institutions that take care of folks as they get into their 70s and 80s and 90s.